Hi everyone, welcome back to our Riverside Chats. Today we're diving into the fascinating and at times frightening history of measles and how one of the most effective vaccines ever developed changed the course of public health forever. Measles is a highly contagious viral disease known for causing high fevers, cough, a runny nose, and that signature red rash. But it's not just a rash. It can lead to serious complications like pneumonia, brain swelling, and even death, especially in young children. The virus spreads through the air when an infected person coughs or sneezes. It's so contagious that if someone has it, up to 90% of people close to them, if they're not immune, will catch it. Measles isn't new. It likely jumped from animals to humans thousands of years ago. The first clear medical description came from a Persian physician whose name I'm not going to try and pronounce, around 900 AD, who distinguished measles from smallpox. For centuries, outbreaks would sweep through cities every few years. It was considered a common childhood illness, but it was often deadly, especially for populations with no prior exposure, like indigenous communities during European colonization. By the early 20th century, measles was one of the leading causes of childhood deaths worldwide. Before the vaccine was introduced in the 1960s, measles was practically a childhood rite of passage. In the United States alone, it caused 3 to 4 million cases every year, around 500 deaths annually, thousands of hospitalizations, and cases of brain inflammation. There was no real treatment. Prevention was the only hope, and that came with the invention of the vaccine. In 1963, there was a major breakthrough. Dr. John Enders developed the first measles vaccine. It was an inactivated or killed virus. Good, but not perfect. Then, in 1968, an improved version came along, a live attenuated vaccine, meaning the virus was weakened so it couldn't cause disease, but still triggered immunity. This version, developed by Dr. Maurice Hilleman, became the gold standard. In 1971, the MMR vaccine was introduced, combining protection against measles, mumps, and rubella in a single shot. It was safe, effective, and dramatically reduced the burden of all three diseases. Thanks to widespread use of the vaccine, measles cases dropped by over 99% in the United States. And in 2000, it was declared eliminated from the country, meaning there was no ongoing transmission. Globally, the vaccine has saved millions of lives. In 1980, measles killed about 2.6 million people every year. By recent counts, that number is under 100,000. That's a massive public health success. And now the world is working on measles eradication. Measles eradication is technically classified in 2 stages: elimination and eradication. Elimination means that there is no ongoing spread of measles in a specific area, like a country or a region, for at least 12 months. It doesn't mean that measles is gone forever, but that it's no longer spreading locally, while eradication signifies the global interruption of measles transmission altogether, allowing for control efforts to stop. As of December of 2023, 82 countries had achieved or maintained measles elimination worldwide. This includes all the countries in the Americas, with Brazil being verified as free of measles in November of 2024. Even with 82 countries being verified as free of measles, there are still challenges. In recent years, measles has made a comeback, even in countries where it was once eliminated. Why? A mix of vaccine hesitancy, misinformation, and limited access in some regions. Outbreaks have occurred in the United States with 712 cases in 25 jurisdictions since January of 2025, as well as Europe and many other parts of the world, reminding us all that if vaccination rates drop, measles comes roaring back. So what's the takeaway of this video? Measles is a preventable disease with a powerful vaccine. It's one of modern medicine's great success stories, but it's also a warning. We can't afford to take vaccines for granted. Staying informed, supporting science, and keeping up with vaccinations doesn't just protect individuals, it protects entire communities, which is what public health is all about. That's just some food for thought. Thanks for listening. As always, stay happy and healthy. Until next time.